Contact tracing dates back to the 30s to fight infectious diseases. The basic idea is pretty simple. First, public health investigators find out everyone an infected person has seen and everywhere they've gone over the past several days.
The idea is that somebody who has a communicable disease is diagnosed and reported. The health department talks to that person, understands who they've been in contact with, and what in contact with is defined based on the disease. So for sexually transmitted diseases, it means one thing. For respiratory diseases, it means another.
Dr. Rutherford adds that the problem with respiratory diseases, like the coronavirus disease, is getting a lot of contacts per individual patient.
Right now, we're running about 5 contacts for every single diagnosed patient. So that's, so we have 6,000 people to manage. And in a city the size of San Francisco, which is about 900,000, you can imagine trying to do that in a city the size of Los Angeles or London or New York.
Next, investigators reach out to each one of these contacts to find out if they are having symptoms. People with symptoms may be asked to self-quarantine for 2 weeks and provide a rundown of their own contacts. Then there's the issue of digital contact tracing.
You need to be able to protect people's data, privacy, and their anonymity, which is a trickier thing. In South Korea and Singapore, they were able to do this because they have different cultural, social, and political norms around it. But in the US, for example, that's the big discussion now, is how to do this in a way that doesn't violate people's privacy and also protects their personal data.
Contact tracing is underway in all countries battling COVID-19. The World Health Organization itself has said that nations must beef up contact tracing aside from testing capacities and not to abruptly lift lockdown measures amid uncertainties. Jovic Burmas, UNTV News and Rescue. We serve the people. We give glory to God.